Good morning. Welcome to Salina Regional's Morning Medical. I'm Mike Maddock. Today's program, I have with me Julie Goetz. Julie is the Director of Physician Recruitments and Business Development at Salina Regional Health Center. Thank you for being on the show.
Thank you.
We're going to talk about, well, something we've been doing actually for a while, telemedicine, which is now coming under a new name as vCare. So why don't you tell us about vCare?
Yeah. So October 2015, we launched telemedicine services. So one of the goals for Salina Regional Health Center is to provide access to patients locally and throughout the region. One of the objectives under that is to expand into telehealth services, allowing to have bringing specialty care closer to home to those patients that are in rural areas in north central Kansas. But we felt like for communication with patients, virtual care was something that would be more relatable versus telemedicine, which is not always a term that a lot of individuals are familiar with outside of the healthcare industry.
How does it work? I guess the best thing to say.
Yeah. So Salina Regional has agreements with 9 different critical access hospitals throughout north central Kansas, and that allows us to then work with those facilities to provide the virtual care to patients. So the scheduling would occur both at the critical access hospital in coordination with the specialty clinic here in Salina.
So when the patient is at one of the critical access hospitals, the equipment is there, and the equipment is there at the physician's office there. So they have somebody with them at the local facility?
So when the virtual encounter is scheduled to occur, the patient would go to their local critical access hospital, and then there would be an individual there at the critical access hospital that would room the patient, take their vitals if necessary, make sure that the equipment is all working appropriately, and would communicate with the specialty clinic here first.
How do people enroll in this program, or is it done through a referral from their primary care physician, or is it from the specialties end?
So a primary care physician can suggest to a patient, say, hey, you might want to follow up with a specialist at Salina to see if your next appointment with them could be done virtually. But really, most of the time, the specialist is the one who's identifying those patients and saying, hey, your post-op visit can be done virtually. We have a contract with the critical access hospital in your community.
Thank you so much. Thank you for watching. For more information, please visit srhc.com, like us on Facebook, and follow us on Twitter.